do this show today. It's our first show of 2025. I want to say Happy New Year's to everybody. Just wanted to update our listeners since there has been changes in administration and also in policy and procedures. And the compliance that the VA we must adjust under this administration. And NU feels that this administration will be open to dialogue in regarding to improved staffing, increase of hiring in all departments, so that the vision of the mission of the VA can be supported, as well as all of the wonderful programs that are geared towards veteran care. The veterans continue to seek care here at the VA. We're very proud that this administration will increase their budget, as we've been told, and they'll increase the budget so that the health care professionals will seek employment at the VA. This will help us to bring the very best to the VA. I'm also proud that the increase in budget hopefully will address the infrastructure and make this a more welcoming environment. Hopefully it will also help to support updated equipment, IT issues, and will help to support our women veterans' health care. That needs to be enlarged because more female veterans are seeking care at the VA. This will also help to increase bed capacity. Many of our veterans come in with a lot of comorbidities, and their stay at the hospital increase in days. So if we increase our beds, we'll be able to support that increase in patient care, the delivery of care. Our patients sometimes maybe wait until they feel it's important to come and see, but we encourage our patients to come and visit with their primary care doctors, if not every 6 months, at least yearly. And they can just walk in. The VA has it where they can walk in. Private sector, you have to make an appointment, and sometimes it takes up to a couple months to get in to see a doctor. But our veterans can come into the VA at any time. So we hope this administration will hear this and contribute to support the veterans who are perhaps don't want to make appointments or need care and don't want to go to urgent care, but they can walk into the clinics and ask to be seen. We'd also like to see an increase in the budget that will also help to support more mental health personnel at the VA. That personnel will help us to deliver better mental health treatments, extend programs for our veterans. Oftentimes we have to send them to other programs in different states. And if we can have those programs in the city or the state that they live in, it would certainly help to encourage them to come in and to get their care at the VA. Our emergency departments sometimes, especially during certain times of the year, is full, and we would like to be able to see them a lot quicker. If we can enlarge some of the emergency rooms so that the capacity will be enlarged and we'll be able to process and care for many more of our veterans as they need urgent care, imaging care even. Our veteran population for World War II, our Desert Storm veterans, They're starting to age, and with aging comes more needs for physical therapy and more medical support. And so we do feel this administration will take that into consideration. NNU has over 100,000 RNs throughout the country, and we're at 23 VAs. We are supportive of our veterans and our veteran nurses. We have veteran nurses that work at the VA. They work side by side with us. And our veterans feel more comfortable seeking care at the VA because they know that our staff have veterans among that staff, that they will probably be able to interact with another veteran who is delivering their care. And that's very important, that our veterans choose to come here and work at the VA to care for their brothers and sisters. We want the very best for our veterans, and we sure know that this administration wants the same thing. We would like to collaborate, and we are the voices of the veterans. We're kind of really like that canary in the coal mine because the nurses tend to have a sixth sense when it comes to caring for our veterans. The other thing is, we see our veterans often and we know them as family. We do go home with our veterans in our heart and in our mind. We think about them. We think about how we could have maybe improved the care that day. Did we do everything we were supposed to do? And then the next day, when our nurses return to work, we're happy to see our veterans, and they're happy to see us because there is a veteran, a VA nurse in the community caring for our veterans, and our veterans care for us. We hope that the new administration will understand the need for flexible scheduling for our nurses. They want flex hours. We want to keep them here. They are experienced nurses. They're experienced in the VA. And our veterans know them and feel comfortable coming here seeking the care because it's like family. Many of our nurses and other healthcare staff has family members who are veterans. They know what the veteran needs. Their fathers, their uncles, their brothers, their sisters, their aunts, their sons, their daughters may be a veteran. And therefore, that's another reason that motivate them to provide the best care possible that we can provide for our veterans. Our veterans are very dear to us, and we want employees who are reliable and loyal, trustworthy, and caring for them. And that's why it's very important that the Congress and the Senate supports the budget of the VA so that we can hire staff in the VA who will want to come and work because their pay will not be impacted. Private sector does pay more. Our staff here is dedicated to our veterans. Oftentimes, you can go down the street, up the street, across the street for more pay, but the staff chooses to stay in the VA. And the reason is for the care of our veterans. We enjoy our veterans. We laugh with them. We cry with them. We celebrate the birth of their grandchild or even their child. They come to us with their most personal problems and concerns. And we want to have that time to be able to listen to them, to offer to them that support that they seek at that time. If we don't have adequate staffing, it's like we're running from one emergency to another and feel very bad that I can't stay and talk with that patient for a few extra minutes. I had a patient once who stated he was happy to see me. He hadn't seen me for a couple days. And he had confided in me that he was feeling suicidal and he wanted to talk to me. And I always will carry that in my heart that that patient trusted me enough not to harm himself and to wait until he was able to talk to me and we were able to get him the care that he needed. Many of our veterans, especially with mental health issues, are separated from their families and from their communities because of their mental health problems. But at the VA, all of our staff are prepared to care for those patients who are in crisis, who may need that extra minute. And with appropriate budget, the VA will continue to be able to supply, will be able to supply that time to our veterans to hear them because we'll have enough staff, you know? Sometimes we just go to check on their IV and we can't just run in and run out. They may want to talk. They might have questions. They may feel confused and scared. And we need to have that time to be able to offer them that comfort and that support that they need. We need our staff to stay in the workforce. We don't want to lose staff. It takes a long time to train and to gain that experience to be a nurse to our veterans. And so we would like the environment of the VA to be supportive of the staff that we have here. And I'm sure they will. I'm sure they will. I have all the confidence that this administration will hear and understand the needs of our veterans. Our veterans come from all walks of life, all walks of life. Some of them live in the streets. Some of them are homeless. Some of them are raising families in middle income environments. And then some are living in upper income environments. Our veterans are in everywhere. They're everywhere. They're in our stores, they're in our restaurants, they're in our warehouses. And those veterans, male and female, needs the VA to help to support them. Their children want to know that their parents are being cared for. And oftentimes, I see the veterans come here with their grandchildren or their children to receive care because they're proud to come here and to meet, introduce their kids to the staff. And the kids sometimes will stay and they'll buy their lunch for them in the lunchroom, and the veterans will spend that extra time with them. Some of the veterans are single parents, and they need that extra support to help them through their activities of daily living, the challenges that they face as single parents. The VA can offer that with our social workers and our psychologists and psychiatrists and our mental health staff and our nurses. Many times the family come to visit their veteran that may be an end of life, and they also need that extra support. The veterans need the nurses to be there and to show them compassion. They're not a number to us. They're not just a number. They are a special, special group of people who have dedicated their lives or part of their lives to helping to support America. And we as Americans federal employees. You can't be a federal employee unless you're American, to help to support them and give them what they need. Our veterans often need time to be educated on the medication that they're taking. And some of them now are starting early stages of dementia or Alzheimer's. And it takes more time. I can't just say, well, here's your blood pressure pill. I've even advocated on my unit that the patients be given the same medication from the same distributor so the color of the meds or the shape of the med doesn't change, so that they can recognize their meds and take it as prescribed. But our mental health patients, oftentimes, if their meds are changed, they will not stay or be compliant with that medication. And then we have to start all over with them. I've been in the VA for a few years. I wanted to leave. I only came to help support the veterans through the Gulf War. But after I came here, I decided to stay. This was home for me. This was the passion of what I do, the reason why I became an RN. And our other nurses feel the same way. We often talk about it. They can go across the street, they can go down the street, they can go a couple miles closer to home. They can make more money working someplace else. But those of us who've chosen to stay here, it's not about all of that. It's really about our veterans and having them seek their care at the VA. We know that some of them may go in the community because for reasons, several different reasons, we're not always able to get them in as timely as we could. But if we had larger facility, if we had more staff, we would be able to decrease that time, that wait time. However, as a private citizen, I do know that we see our veterans timely, more timely than if they went into the community. Because oftentimes, as we all may know, we might have to wait a couple months to even get an appointment. They will tell us to go to the emergency room if if you have to come and see a doctor sooner than that. But our patients can come in and walk into the clinic and be able to see any of our clinicians to get the help that they need. We want a healthy veteran. We want their health to be primary. We want their health to be in front of every American's concern. And we want to be able to deliver that health care to them at the VA. The VA care has to be transparent. When they go into the community, they may not necessarily have that transparency. It's another reason why the VA is so important in the delivery of care to our veterans. This is also a teaching facility, which is very good. I always try to choose teaching facility for myself because you have many more eyes on that situation and you can discuss it and you can talk about the best practices and the nurses can confer with each other on something that they may see that needs immediate attention. Again, another reason for our veterans to come to the VA. Another reason that I feel this administration will provide a budget that is necessary to make the VA a world-class model for delivery of care. World class. That's the kind of care our veterans should have. Our IT infrastructures need to be updated, and our infrastructures overall need updating. Facilities are not large enough to help to support the amount of veterans we have coming in. So we need to be able to have maybe longer hours to care for our veterans. Our veterans are working now, and sometime due to work, they may not be able to come in a morning appointment, but an evening appointment a couple times a week may help to support them in their delivery of health care, support them to get the care that they need. I encourage all of you, if you have a veteran in your circle of friends, in your family, just people that you know, because sometimes I just get in conversations with strangers, and we encourage them to come to the VA. We know that this administration will look at the veterans' needs very closely, and will ask for the budget that is needed to support the VA. Again, keep in mind that our veterans tend to need more extensive care. That is called comorbidities. They may come in with the flu, and then we find out that their blood pressure needs to be adjusted. So we handle that. But if I go to my doctor, I have to make another appointment to come and see them about the blood pressure. But here at the VA, no, it's one-stop shop. Come and see us. If you need us, come and see us. We need to see you. We need to have you here. I also want to take a moment to thank the Cliff Kelly and American Heroes Group for being a media partner for over 5 years with NNU. We celebrate this platform to help distribute vital information to our listening audience. Our veterans tune in to Cliff Kelly's show to get a lot of information that is provided to them on several issues. And I'm happy to be a part of this show and happy to be here tonight to be able to talk to our veterans, be able to support our veterans, and to be able to let them understand that when they come to the VA, they're in good hands. We are committed to being here for them. I'd like for all of our veterans who are listening who is not registered at the VA to please register. Just come and register. Even if you choose not to get care here, come and register as a veteran, because one day you may want to get your care here. I know veterans who've gotten knee replacements, who've gotten heart health care, and they've all been very satisfied with the care that was delivered to them. So come and register. Come and register. This administration is going to provide the services that you need. They are going to provide the health care that you need. For women veterans, please know that you are welcome here, that you are welcome at the VA, and that we want you to come here and get your care. And we offer care for female veterans that is private, and they are in their own section, and they can feel safe coming here to the VA. We want you to come here. To our younger vets, you may think there's nothing wrong with me and I don't need to go to see the doctor, but you should be getting that yearly exam. You should be getting a prostate exam. If you're a male, females, we have other healthcare needs, mammograms. That's another thing with the budget. We'll be able to expand our care for our female vets. So please come. Please know that the employees at the VA want you here, and we want to support you on your health care journey. I'd like to give you a second to think about this. You can go online and you can call whatever VA in your area. You can set up an appointment. They have social workers, they have doctors, they have psychologists, they have psychiatrists that will help you if you are in crisis. Okay, please come. In the Chicago area, we have 3 VAs, which we're fortunate. VAs are in every community in every state. They're everywhere. They're there for you to come and get your treatment.